Welcome back to Second Opinion Pod with Dr. Dua Hassan. As you know, Dua is a pediatric physician at Boston Children's Hospital and a former instructor at the Stanford University School of Medicine. Dua, how are you today?
I'm doing great, James. I'm excited to be here with you and to talk about the erythromycin ointment.
Yes, or as I have been calling it, the Eye Goop. And just to put us in context here, we're continuing our first day of life series where you kind of walk us through the things that happen right after the baby comes out. And tell me about the Eye Goop and why it matters and why we use it.
Yeah. So, as you know, James, as a father of three, your baby's born. The nurse takes the baby away from you. And then before you know it, she's squeezing a bunch of goop into the eye of the baby,
Yeah.
making their eyes all blurry and, ointmenty. And then you get your baby back and you're like, what's going on? Why is my baby have like this lubricant all over its face? And I think a lot of parents don't actually know why we give it. And so that's why I wanted to talk about it today.
Yeah. So if you had asked me before we decided to talk about this, I would have said that it was Vaseline. I wouldn't have known why it was on my child's eyes. So I'm excited to actually learn about what this is, why we use it. Tell me what's going on here.
Yeah. So essentially, the goal of the ointment is it's protecting the baby against something known as neonatal conjunctivitis. Conjunctivitis is just a fancy word for the fact that the conjunctiva part of your eye gets really inflamed and red. I'm sure you've seen
Is
your
that pink
kids.
eye?
Pink eye is one form of conjunctivitis. And the neonatal form in particular is caused by two pathogens that you've probably heard of as well, gonorrhea and chlamydia. And so of the two, the one we worry about more so is gonorrhea. And gonorrheal neonatal conjunctivitis usually presents very early in the first 24 to 48 hours of life. And that's why we want to give the ointment as soon as possible. And gonococcal conjunctivitis used to be one of the leading causes of blindness in babies. In fact, I read a study that suggested that prior to us having interventions, up to 10% of babies in Europe suffered from gonococcal conjunctivitis. So it's something that we worry a lot about, and that's why we give the erythromycin ointment. The other pathogen that I mentioned, chlamydia, is less severe but a lot more common. So I've personally have never treated anyone with gonococcal conjunctivitis because of the universal erythromycin ointment. But I have seen kids with chlamydial conjunctivitis. That presents usually later around like 7th day of life. Not as severe. It progresses much slower. And part of the reason why we still see that is because the erythromycin ointment isn't quite as robust against chlamydia. It works really well against gonorrhea, but less well against chlamydia.
I'm going to say what a lot of probably our listeners are thinking, like, aren't those STDs? And do they give these, how does this become universal? Is that something that you could skip if you've got an STD? Talk to me about that.
Yes. So you're absolutely correct. Very astute. They are both STIs and they are both very common STIs. I'm sure you know that, James. And so, even though we universally screen moms for these two, it is still, in my opinion, advantageous to just from a prophylactic standpoint, give it to babies because these infections are so prevalent in the common population that even if you screen negative in your first or second trimester of pregnancy, you could still get it in the third trimester. The tests that we do for moms are generally pretty accurate. They catch about 95% or so of infections, but it's possible that mom is an asymptomatic carrier. It's possible that, when you swab, a lot of the tests are swabs of vaginal fluid that for whatever reason, the sample you got maybe, I don't know, depending on the way the lab runs it, the way it was collected may not
Like a
pick
false
up.
negative. Yeah.
Exactly. It could be a false negative. In terms of testing the baby, you're right. That would be great if we could do that. But unfortunately, if you remember how I mentioned that generally speaking, gonococcal conjunctivitis presents in 24 to 48 hours, that's a very short window. And then the way we would test the baby is by swabbing the fluid coming out of the eye. So if you think about it, that would mean that the baby would already have the infection and a severe enough infection that you're producing fluid that we can swab that will, when we run it as a PCR, will run positive for gonorrhea. So you're basically waiting for the baby to have symptoms then versus if you could just prophylactically treat before they ever get sick. And it's a pretty simple, it is oily and gooky and a little bit gross, but it's a very simple thing to apply to a baby and it just protects them so well.
Right.
And I think this is a really good question, James, because as medicine progresses, our goal, instead of just, historically, doctors used to try to guess what a disease is. And now we're at a stage where we know what a disease is and we can treat it. But the future of medicine is prevention. And so
Mm.
anything that can prevent us from getting sick in the first place is kind of ideal. That's where we want to be.
Are there any downsides for the baby other than the feeling that you get when you have an ointment on your eye?
You know, the side effects are really all benign because it's just a topical ointment just on the surface of the skin and kind of the surface of the eye where you're applying it. So, babies have some temporary blurry vision, but to be honest, when babies first come out, their vision is already not that great. So it's a little bit more blurry. You might get a little bit of it on your shirt, when you're holding the baby. Occasionally, I personally, I used to work in the nursery. I've personally never seen this, but occasionally babies can get maybe a little bit of redness or something we call chemical conjunctivitis, some irritation
Mm.
from the erythromycin, but it's very gentle and generally very, very well tolerated. I've really rarely seen any side effects in clinical practice. Interestingly, though, not every country does the erythromycin ointment. So,
Mm.
some countries will do other antibiotics with other really complicated names like tetracycline in Canada.
Mm.
But in the UK, for instance, they don't necessarily always do universal prophylaxis. So there is some debate. Some people feel like if you universally screen the moms, maybe you don't necessarily need to do the ointment. I will say I don't know what the STI rates are in the UK, but I would certainly say that in the US, I think the general burden in the population is high enough that I really
Mm.
think that the prophylactic recommendation is a good one.
And is this ever something that you've had, seen parents have discomfort with? I mean, for me, there's so many things that are happening in those first couple of moments that this really wasn't on my radar. One of the many things that somebody was kind of doing to my child in those moments, but like, do you ever run into people that are discomforted by it?
I think for the most part, people generally are pro ointment or erythromycin ointment. I do
Yeah.
think that there are some people who feel, some people are like, I don't want anything done for my baby. I
Mm.
want my baby as natural as possible. I mean, some people want a home birth. So I think there is a small subset of people who, for cultural reasons, do not want
Mm.
to do it. But I do think it's a good recommendation, just given the fact that, like I said, it has very few side effects and prevents a potentially very serious eye infection.
All right. Well, thank you for educating us about that. And we will see you next time where we'll be finishing out our first day of life series.